For joining us today. It's a pleasure to convene this meeting of the Standing Committee on Justice and Human Rights as we resume our study on human trafficking. As my colleague Rob Nicholson mentioned, we just got back from a cross-Canada tour where we hit Halifax, Montreal, Toronto, Edmonton, and Vancouver, and we got a chance to hear firsthand from literally hundreds of Canadians who are involved in this issue. And we very much appreciate you coming before us and adding to our understanding. I'd like to introduce the witnesses today. From Victoria, British Columbia, we have Dr. Cecilia Benoit, who is professor and scientist at UVic. Dr. Benoit, can you hear me?
Yes, I can. Thank you.
Thank you very much. Do you pronounce it Benoit or Benoit?
Benoit.
Benoit, okay. Excellent. Then we have Ms. Tara Leach, who is a primary care nurse practitioner. Welcome, Ms. Leach. Thank you for coming. And from the Ottawa Coalition to End Human Trafficking, we have Ms. Sherry Lacey, who is the head of the Youth Committee, Social Work, Youth and Family Therapy. Welcome. And Ms. Jody Mosley, who is the head Community Presentation Committee. Welcome. And from the Ottawa Police Service, c'est un grand plaisir d'accueillir Monsieur Damien.
It's a great pleasure to welcome Mr. Damien Laflamme, Sergeant from the Human Trafficking Unit, and Karine Casagrande, Crime Analyst, Human Trafficking Unit. Thank you so much for being here. So this is how we'll proceed. We will follow the order.
It means that we're going to start with Dr. Benoit. You have 8 minutes. The floor is yours.
Thank you. So I don't miss any points, I'm actually going to read my presentation. So I gather your study aims to shed light on human trafficking in Canada. Understandably, we are all interested in making sure that vulnerable people are not exploited or taken advantage of. Such criminal behavior needs to be prevented, detected, and prosecuted. Despite sensational claims, the good news is that human trafficking is not widespread in adult prostitution in Canada. In fact, it appears that most adults who sell sexual services in our country have freedom of movement to work and are not coerced or exploited by others. I draw this conclusion from the accounts of over 1,200 people who my colleagues and I have interviewed in different studies in the last 2 decades. As there is no random example to select from, we use a variety of strategies, including internet sites, community contacts, and participants' own networks to capture the experience of a wide group of people. We found that many of our participants belong to informal groups where they have friendships with other workers, share safety strategies, develop regular clientele, and create connections with those operating escort agencies and massage parlors. We have found overall that these networks increase the health, safety, and well-being of individuals engaged in adult prostitution. Further, these networks mean that when human trafficking is happening on the ground, our participants are likely to hear about it. Even though their past negative experience with the police and in the justice system are major barriers to reporting activities, which I'll note below, our participants were very frank in their interviews with us. So today, I want to touch on a few of our research findings. More results are available in our peer review articles. But first, a short summary of our participants from a recent Canadian study. In 2012-2013, we interviewed 218 individuals from 6 Canadian cities. To take part, participants had to be 19 years of age or older, legally able to work in Canada, and have exchanged 15 or more sexual services in the last 12 months. Participants ranged in age from 19 to 61, and most were in their 30s. Their median annual income was just under $40,000. 3/4 identified as women and 20% identified as Indigenous. The average age at which they sold a sexual service was 24 years. 18% said they had done so before age 18. Over half worked independently off-street, 20% worked independently on-street, and 25% said they worked mainly in a managed setting, such as a massage parlor or an escort agency. Pertinent to this study, 6% were forced or exploited to sell sexual services at any point in their lifetime, but none said they were currently being controlled by what is commonly called a pimp. The vast majority said the main reason they got involved was the need or desire for money, which is a similar reason most Canadians working in occupations. And also 35% were involved in other kinds of work as well as prostitution, and 20% were enrolled in an educational program. So as I mentioned above, we wanted to know more about their views on the justice system, and here's what they told us. 2/3 said they had little or no confidence in the police, which is 4 times higher than other Canadians. They had 3 main reasons why they felt this way. Their first concern was discrimination. Half of them had experienced judgmental treatment in the justice system caused by stigma towards and about them. One participant said, "They're disrespectful. Police say if you're going to get paid for sex, then you can't be raped." Another participant said, "I had one cop tell me I'm just a native whore." Their second concern was fear of being arrested. One participant stated, "I've known sex workers who reported the crime that they were a victim of, but when the police found out they were in street sex work, they ended up getting arrested instead of the person who had committed violence against them." And their third concern was targeting of their workplaces. Participants said that the police made their work, quote unquote, harder and less safe by targeting escort agencies and other safe workplaces when they should be going after traffickers. One participant put it this way: "You know sexual slavery is going on, yet the police don't do anything but waste your time going after small agencies that run well." These actions undermined our participants' trust in the police, increased their suspicion of law enforcement, and discouraged reaching out when someone or themselves were in danger. In contrast, some participants countered with positive accounts of police officers who were respectful and who did use discretion in law enforcement. Also noteworthy was the variation between the cities that we studied in police confidence. So in closing, I would like to leave you with these takeaway messages. First, adult consensual sex for money is not human trafficking. It is vitally important not to conflate the two so that we are better able to address actual cases of human trafficking. Second, adults who sell sexual services are more diverse than they are usually portrayed, and their access to health and safety services should be non-conditional and non-discriminatory. Third, coercion and exploitation in adult prostitution are much less common than is claimed. Fourth, police need to improve their relationships with people who sell sexual services so that they feel confident in reporting crimes without fear of being prosecuted or put under surveillance. And finally, targeting commercial sex locations forces workers to find clients in other ways, which may make them more vulnerable. It also wastes police time and resources that would be better used to find actual traffickers and the victims. So thank you for this opportunity to present these research findings, and I look forward to your questions.
Thank you so much. We will now move to Ms. Leach.
Thank you to the House of Commons Standing Committee on Justice and Human Rights for inviting me here today. I am thrilled to see that the committee is interested in hearing about the intersections of healthcare and human trafficking. As mentioned, my name is Tara Leach, and I am a primary healthcare nurse practitioner. For the past 20 years, I've worked with victims of violence within both primary care and emergency settings, both within Ontario and many of the northern states of the USA. I have worked with ages across the spectrum, spending time in facilities that focus on children, youth and adolescents, and adults. While I had already been exposed to patients who were experiencing human trafficking, I did not come to know the term until I was introduced approximately 7 years ago through my husband's politics class. In truth, as a healthcare professional, I had never been taught about human trafficking, what it was, how to identify someone intervene, or respond effectively. In fact, if I had waited for an opportunity from my professional organization or institutions that I had worked for to teach me about human trafficking, I would still be waiting. With this in mind, I present to you what I feel is a significant gap when I look at Canada's strategies to address human trafficking. Research tells us that healthcare providers are one of the few professionals likely to interact with trafficked women and children while they are still in captivity. Studies have reported that upwards of 84% of trafficked individuals saw a healthcare professional while still in captivity. This represents a serious missed opportunity for intervention. Healthcare providers are in a unique position to identify victims of trafficking and provide important physical and psychological care to victims while in captivity and after. The healthcare problems in victims of trafficking are largely a result of several factors: deprivation of food and sleep, extreme stress, hazards of travel, both physical and sexual violence, and hazardous work. Because most victims do not have timely access to healthcare, by the time they reach a clinician, it is likely that health problems are well advanced. These women are at high risk of acquiring multiple sexually transmitted infections and the sequelae of multiple forced and unsafe abortions. Physical abuse and torture often occur, which result in broken bones, contusions, dental problems, cigarette burns, and from my experience, this population has a significant incidence of strangulation-type injuries. Psychological violence results in high rates of post-traumatic stress disorder, depression, suicidal ideation, drug addiction, and a multitude of somatic symptoms. In my experience of working with victims of trafficking, victims are less stable, more isolated, have higher levels of fear, more severe trauma, and greater health needs, more than any other victims of crime that I've previously served. In fact, one study even quoted that one trafficking victim can take the same amount of time, the provider's time, as about 20 domestic violence victims. Further to this, we now know through research that trauma has lifelong effects, and it of itself can be considered a chronic illness, one that will prove costly to our system if not properly managed. When I look at Ottawa, my home community, I reflect on how many primary healthcare providers are employed within hospitals and walk-in clinics, places where it is known victims of human trafficking access care. How many do you think have taken a personal interest and continued with this interest to evoke change and recognition to our healthcare system like I have? How many do you think understand human trafficking, know how to recognize and respond to human trafficking, work in environments that even support care of trafficking victims? As you may have guessed it, not many. When I look at our very stressed healthcare system, I understand competing interests and needs. I understand that patients that yeah.
Can I ask you to just slow down a little bit?
Oh.
The interpreters that are doing it into French are currently having some issues. So if you could just slow down.
Yes, no, I'm sorry. I talk fast anyway, let alone when I'm nervous like this.
I do too. Don't worry about it. I do the same.
Shall I begin where I left off?
Yeah.
Is that okay?
Yes, please.
When I look at our very stressed healthcare system, I understand competing interests and needs. I understand that patients that I have described contradict the treat and street funding philosophy of our healthcare system. That the one problem that may get focused on is the most obvious, and the one that healthcare providers may know how to treat. Healthcare professionals are not aware of human trafficking as there is no mandated education for human trafficking. There are no requirements for licensing that this is learned within professional reporting requirements. There is no developed standard education within medical schools or nursing schools to even open the awareness that this could be a potential patient. Healthcare providers are not aware, and they do not have the tools or even sometimes the permission to spend the necessary time with patients to navigate their needs. What I would like to propose is that healthcare providers are seen at more tables when issues like this are discussed. We need the opportunity to discuss how our current healthcare system is in fact inaccessible to victims of human trafficking. We need to discuss the stigma and shame that silences victims and prohibits disclosure because our system is not trauma-informed, and it should be. We need to discuss that care is not coordinated and often in keeping with changing and very dynamic needs of those who have been trafficked. For clients, previous experience with stigma, judgmental attitudes, and punitive treatment by providers negatively influence healthcare engagement, especially among marginalized patient groups. Despite laws recognizing trafficked persons as victim of crime, the perception that survivors are complicit in criminality persists. Research and practice indicates that human trafficking survivors experience stigma, discrimination, marginalization, institutional violence, and distrust of official systems, which includes healthcare professionals. Too often I hear patients recognized as being in the sex trade and not identified as being trafficked. The change of language will change referral sources and a frame of mind when caring for somebody of this experience. Because of the high rates of abuse and violence, human trafficking associated with substantial trauma, I've gone over this. Limited research, however, exists to develop an effective model of healthcare delivery for human trafficking survivors. But practices that have been effective in other marginalized groups provide an initial roadmap. An example of this is actually based here in Ottawa. Voice Found, a survivor-led organization, has opened up Canada's first healthcare clinic focused on human trafficking, and I happen to be the lead healthcare provider for this clinic. The health clinic is one example of a trauma-informed, survivor-centered, comprehensive health clinic that provides long-term primary and preventative health care, as well as case management to survivors of human trafficking aged 13 years and older. Innovative practices implemented at our clinic are derived from principles of trauma-informed care and psychological literature for a phased-based model of trauma treatment. A trauma-informed approach to treatment encourages therapeutic engagement with healthcare services and fosters healthcare access behaviors. While clinics like this can provide rich data to your committee, challenges related to financial sustainability need to be overcome. Our clinic has only 3-year funding provided by our province and has capacity to only be open 2 days a week, which already isn't enough for our demand. As you gather your data, remember our clinic here in Ottawa and healthcare professionals like me who took personal interest and have continued to invest my own time to learn more because clients need me to. Oftentimes, advocates are born from personal experience. I am not such an individual. Instead, I have been inspired by the strength of survivors, I have taken note where healthcare has not been accessible because they did not have the right card or the right attitude. Healthcare providers cannot ignore human trafficking as an issue, and our government can no longer ignore the fact that healthcare is challenged and oftentimes inaccessible to persons who need it most. Healthcare is an important part to consider when looking at strategies on how to address human trafficking. No matter the moment, healthcare is generally part of a person's experience, and prevention efforts need to be framed to match a person's needs. I thank you for your time and for offering me this opportunity, and I look forward to your questions.
Thank you very much. We're now going to go to the Ottawa Coalition to End Human Trafficking.
So thank you to the Standing Committee for the opportunity to present on behalf of the Ottawa Coalition to End Human Trafficking. The Coalition is a volunteer-based network that works to meet the service and resource needs of those affected by all forms of human trafficking. To our knowledge, we are the only organization offering an established training program for service providers to develop their ability to identify a trafficked person and to know how to respond appropriately. As mentioned, my name is Sherry Lacey, and I've been the head of the Coalition's Youth Committee for about 3 years. I've also been working as a social worker with youth and families, including victims of trafficking, for about 12 years. I will begin with a declaration that human trafficking is modern-day slavery that is alive and well in Canada. It exploits for profit by extracting sex, labor, and/or human tissue and organs through deception, coercion, or force. It is a gross violation of a person's most basic and fundamental human rights, and sadly, no person or community in Canada is immune. The focus of our coalition work is on the response, and it is important to recognize that an appropriate response that is effective is also extremely complex and must consider the following factors. Firstly, before a victim exits a trafficking situation permanently, they typically return to that situation multiple times. For a response to be effective, it must understand and take into consideration the reasons behind this in order to prevent it. Secondly, the needs of trafficked victims are unique to the experience of each person. No two situations or sets of needs are the same. Why, might you ask? Consider this. We have seen victims forced to have children with their traffickers. We have seen youth who have been trafficked out of the bathroom stalls of their high school or over their lunch hour. And we have seen adult victims who are incapable of giving legal consent to exit a trafficking situation because their trafficker has forced them into a drug addiction and a constant state of psychological fear. The needs of these victims are vastly different, and therefore, a one-size-fits-all approach will ultimately be unsuccessful. The obstacles faced by trafficked persons in trying to access services and resources allow the coalition to conclude that the current response to human trafficking does not take the above factors into consideration in a meaningful way. To this end, I would like to highlight the need for a renewed national action plan to combat human trafficking that includes all provinces, territories, and Indigenous communities. This plan should be driven by input from grassroots frontline professionals who work directly with trafficked persons within established codes of conduct. These workers understand the wide range of unique needs and challenges in accessing services and resources. Secondly, it should also include standardized data collection about the human trafficking landscape in Canada, so that it may inform the development of an effective response. Thirdly, there is a need for the advancement of services dedicated to factors that link with human trafficking, including addiction and homelessness. The needs of specific groups such as youth, Indigenous peoples, LGBTQ individuals, and migrants must also be incorporated. Lastly, all forms of human trafficking need to be addressed in the plan, including trafficking for labor exploitation and trafficking for organ and harvest removal. In Canada, the demand for organs by patients in need of transplants far outweighs the available supply. Anecdotal evidence suggests that some of the demand is met by Canadians purchasing organs from the red market, which is known to extract organs from donors by force or without their knowledge or consent. More work is needed to better understand this form of human trafficking. I will now turn this over to my colleague Jody Mosley for a more detailed look at the gaps. Thank you again.
Thank you. So my name is Jody Mosley, and I'm head of the Coalition's Training Committee, and I have been so for a number of years now. I'm also the co-director of a foster care agency here in Ottawa that specializes with high-risk youth from all over Ontario, as well as co-founder of A New Day, which is the first ever here in Ottawa residential treatment program, which is dedicated to victims of human trafficking in the NCR area. And so I could say that I know for a fact that I've been working with human trafficking victims for at least 4 years now, but putting on the new lens, probably the last 30 years that I've worked with high-risk youth. We're just looking at it through a different lens now. So as head of the training committee, I would like to begin with a word about training. It is true that the spotlight on human trafficking has increased awareness and resulted in progress. The police now have human trafficking in their formal initial training, and we have a human trafficking team. The steps are being taken to train those employed in the aviation industry, and the Canadian Federation of Medical Students, in collaboration with organizations like ours, is working to include human trafficking as part of the medical curricula. And this is great news. However, we have a long way to go. We still have law enforcement who cannot distinguish between cases of human trafficking and those of domestic violence. We have doctors and teachers who don't know how to identify human trafficking, and academic and medical institutions that don't have protocols for properly responding to the cases of human trafficking. Just 2 weeks ago, we were made aware of a case where a trafficker, dressed in medical scrubs, accessed his victim, who was a patient in a local hospital where supposedly security measures have been put in place. There is a clear need for investment in establishing protocols that outline step-by-step courses of action with built-in security features that are supplemented by ongoing training. Building on required elements of an effective response as outlined by Sherry, which includes training as I've just outlined, there is also a need for improvement within the criminal justice system and how it deals with human trafficking. The current legal framework that requires witness testimony, thereby re-victimization of the victim, is ineffective and serves to discourage victim testimony. Traffickers need to be held accountable, prosecution needs to be a real threat, and sentencing needs to be severe, and victims need to be assisted through the court process in a meaningful way by professionals and mentors so that their criminal justice system experience contributes, and I highlight contributes, to their healing journey. Another key element of an effective response is a well-targeted information campaign that delivers information about the availability of services directly to persons in a trafficking situation. This campaign needs to be informed by grassroots frontline workers so that it is delivered in a way that does not put the victim at further risk. For example, information campaigns that splatter a hotline number all over the media and ad posters will trigger traffickers to check phones of their victims for these numbers, and that could put the victim's safety at further risk. Lastly, I would like to talk about licensed establishments. We know that legitimate businesses such as strip clubs, massage parlors, spas, and hotels have also been known to be venues of human trafficking. We also know that new private member clubs are opening up and they don't have a storefront. And they don't always have a business name prominently displayed. They exist in a clandestine way, and you need to know of them, you seek them out. The explicit descriptions of their services on the website makes it obvious that sex is sold on-site, yet they have managed to acquire liquor licenses and ATM machines which enhance their legitimacy as a business and hides traces of monetary transactions. Anecdotal evidence suggests that trafficked female victims are being dropped off and picked up at these clubs by their traffickers. It is unclear whether the owners or operators are aware of this. Hence, it is important for the government to conduct a review of the regulatory policies governing the establishment and operations of these type of businesses, coupled with a heightened level of enforcement. Further, as these establishments are disproportionately linked with human trafficking, it should be mandatory for them to post information on site that has available services for trafficked persons. This information should be posted in prominently visible areas, similar to advertisements on gaming sites regarding gambling addictions or photos of the consequences on cigarette and smoking on cigarette packages, as well as the health and safety and victim services that happens in government buildings. I would like to conclude by saying that while much work is needed, we have a meaningful impact on this issue. Consultations such as this make us hopeful that we will get there. Thank you.
Thank you very much, and we'll now move to the Ottawa Police Service. Sergeant Laflamme.
Good day. I'd like to begin by thanking the members of the Standing Committee on Justice and Human Rights for the opportunity to be here today. It's both a pleasure and a privilege to be able to contribute to your study on human trafficking in Canada. Put together everything you know about a kidnapping victim, a domestic violence victim, a rape victim, a child abuse victim, and a person with addictions, and you have the reality and the mindset of many of the human trafficking victims that we encounter. More needs to be done to understand these individuals and to support them. I'd like to begin by telling you a bit about the makeup of our team here in Ottawa, our mandate and our goals, as well as our approach to working collaboratively with survivors of human trafficking. Our Ottawa Police Human Trafficking Unit was officially created on the 23rd of January of last year, after a lengthy pilot project. Our 6-person team is comprised of 4 investigators, a full-time crime analyst, and myself, the sergeant who oversees the unit's activities and investigations. In the last year alone, we've seen an increase, a 21% increase in active investigations where we've laid charges. This equates to approximately 10 additional investigations per investigator for the year. Our mandate is to identify victims and survivors of human trafficking through both proactive and reactive investigations, and to support the prosecution of the traffickers. Our unit's main objectives are to render assistance and offer support services for any and all survivors wishing to exit the sex trade work. We diligently investigate and prosecute any traffickers once survivors are ready to come forward and provide statements and proceed through the judicial system. We raise awareness and educate partners and stakeholders about human trafficking. And we also treat every victim and survivor with the utmost respect and dignity. Here are some of the successes and best practices that I can share from our experiences here in Ottawa. We, at the Ottawa Police Service Human Trafficking Unit, aim to conduct many proactive initiatives as possible. We participate in national and as well as provincial initiatives, including the Northern Spotlight Initiative, where we work collectively with other agencies to identify and locate victims of sex trafficking. During high-profile sports events, such as the 2017 Grey Cup and the week leading up to it, we reached out to 21 sex trade workers. I'm happy to report that our unit, in conjunction with the Gatineau Police Service, managed to rescue 2 sex trade workers who opted to take our support services and leave their traffickers. Although from a police perspective, no charges were laid, these 2 cases are most certainly viewed as successes in our eyes. With the assistance of our victim support community and their resources, one of the survivors was safely returned to her family and friends in another province. Our team has always had a victim-first approach, and we always aim to reach out in a very non-threatening manner, and we make it clear that we are there to help rather than to prosecute victims. We connect victims with community resources and offer safety plans for those not yet ready to exit the sex trade. We at the Ottawa Police Service Human Trafficking make it a point to treat each and every one equally, as we only get a glimpse into their lives, their stories, or their experiences. In the words of Maya Angelou, I've learned that people will forget what you said, they will forget what you did, but they will never forget how you made them feel. We have had much success with this approach, and we are hopeful that more police agencies will respond in the same manner. If all police agencies took the approach, I feel that we would see much more cooperation and willingness to provide information about traffickers. The trust in police would exponentially grow. We would aspire in the future as well to bring along outreach workers with lived experience to better relate and empathize with survivors, thus increasing the trust in us and the process of exiting the sex trafficking world. In terms of the challenges we continue to face, I would say education continues to be an area where much more work needs to be done. As I mentioned, we exponentially increased education and awareness of trafficking through meetings, information sessions, presentations to organizations such as law enforcement training facilities, community organizations, border services, and regional hotel associations. We have started to work with post-secondary institutions and would like to expand our outreach to transportation hubs such as airports, bus and train terminals. This has certainly generated an enormous increase in investigation and follow-ups from various community groups, school boards, as well as stakeholders. As a result of our increased community partnerships, we've been able to identify more sex trade workers, maintain contact with victims, and connect them with ongoing community services and assistance. Despite our efforts to raise awareness, we have noticed that increased understanding of the realities and the complexities of human trafficking victims would be beneficial at the judicial level. It's quite an extensive process to assist our survivors during the judicial process until such time as their trial goes to court. They're always re-victimized by preliminary hearings and then the actual trials. Making some concerted efforts to minimize their testimony and accept their sworn audio and video statements in court would go much further in instilling and restoring faith in the judicial process for all our survivors throughout the country. Prosecuting traffickers has proven very difficult. As I've mentioned, most survivors have been manipulated and convinced to be distrustful of police. Subsequently, court testimony has been a major hurdle for our investigators. More often than not, traffickers have managed to affect and threaten our survivors in a negative way prior to them testifying in court. Numerous survivors refuse to testify and recant their statements while awaiting trial, putting lots of the investigations in jeopardy. We anticipate much success in the wake of the Ontario Court of Justice project appointing judges to bail hearings, specifically in our jurisdiction. This concerted effort by the Ministry of the Attorney General will assist in increasing the prospect of detaining traffickers pre-trial. We are aware of the push to have criminal code amendments which would remove preliminary inquiries. This would certainly minimize any re-victimization of our survivors prior to trial. With the hard work of our investigators and prosecutors, over the last few months, we've seen some very successful convictions within our provincial courts on human trafficking cases. These types of investigations are being recognized for their complexities. And to conclude, if I could leave the committee with these observations about addressing the needs of human trafficking victims, coordinated efforts by police, community support organizations, and the judicial system continue to be at the source of our success stories when it comes to the service provided and offered to our survivors. We will need to continue to strengthen our partnerships with stakeholders for the benefit of these survivors. Thank you very much for your time, and I'm happy to answer any questions the committee would like to bring forward at this time.
Thank you so much to all of our different witnesses, and we'll now go to questions. We'll start with Mr. Nicholson.
Listen, thank you very much, and thank you to all of you for your testimony here today, Ms. Leach. One of the things that you said that you've been in this business trying to help out for the last 7 years, and you were completely unaware of most of the aspects of human trafficking. You said you might still be there today if you hadn't gotten involved with this. I mean, first of all, one of the things that we are doing here by having this study and indeed going across the country is part of the effort that I think we're starting to see in this country, that to raise the awareness of human trafficking. And so you said, among other things, that healthcare is inaccessible to the victims. How so? I mean, can't they go to a hospital? Can't they see a doctor? What's the whole?
So I guess in terms of, it depends on what the goal looks like. So yes, if I had a broken bone, I could indeed go to an emergency room and I could have that broken bone fixed. But the likelihood of me attending follow-up in the situation that I'm in, the likelihood of the full root of the problem being uncovered as part of a healthcare visit is what I mean by inaccessible. So certainly people can go to a walk-in clinic, an emergency room, and sort of have that need attended to. But the underlying awareness of what human trafficking is, understanding what the root of that person's problem might be, maybe understanding the behavior, perhaps questioning how that broken bone actually occurred versus what the history might have been given, is what I mean by that. Also, if I don't have a health card, then I'm not able to go to an emergency room or a walk-in clinic. If I don't speak the language, then I'm not generally able, or sometimes the translator that might be provided might be the person who brought me to the emergency room, who actually might be my trafficker. So when I look at healthcare and I look at really what that client is there for versus what might be obvious, is what I mean by it being inaccessible. Also keep in mind, substance abuse and mental health is something that's very closely linked. And oftentimes when people access places like emergency rooms and walk-in clinics, they may not be their best selves. And so sometimes they are asked to leave, and behavior isn't recognized as being defensive, it's only seen as being aggressive.
Fair enough. Ms. Lacey, you said, you talked about a new aspect of this, and that's that there are people outside this country being human trafficked for their organs. And you pointed out that there is a shortage of organs to assist Canadians that Canadians need. Would it be helpful, do you think, if we decriminalized the purchase of organs or the payment to individuals who provide become surrogate mothers, that kind of thing? If we got rid of that sort of thing, do you think?
Well, I think that the reality with that issue is that it does require more research and more information specific to it. We're only, as the coalition, starting to scratch the surface in that research ourselves a little bit. So I think it would be kind of inappropriate for me to take a position on that at this point. I do think that the healthcare systems in our country are a little bit fragmented in the sense that it's provincially funded, and that there are kind of, other systems internationally that could be looked at for further observation or further research.
Fair enough. Ms. Mosley, you said that there should be more done to investigate the businesses who were in the businesses of sex workers and all that. I mean, we hear both sides of this here, that on one hand, we hear that this is just a legal business here, and why, as long as the individuals get the necessary, the labor rights and freedoms that they are entitled to have, that's okay. On the other hand, we get people to tell us that these businesses are just fronts for the human traffickers. Which is it, or is it a combination of both?
I believe there's a combination of both. So I've worked with a few girls that say they get dropped off by their pimp in the morning, and then at the end of the day, they're walking out and handing their money over. When we look at strip joints, and these are designed to sell sex, which can do, but the people that are going in and buying and paying for this, and when you have a strip joint that says "New Girls Every Day," that's not someone that has their job, I'm working 40 hours a week and I'm going in there because it's my choice. Those are people that are being trafficked through different organizations. One young lady said, I had a choice. I could be a dancer or I could be an escort. And I chose to be an escort because people who would call for the escort or purchasing, a lot of times there could be my friends and the boys, you know, just showing up at a strip joint, and I would be there dancing in front of them, and it would be more public for them to know. So we know there's a combination of both that are happening, but when I look at victims in general, or people that are being trafficked, if they don't know the services that are out there, how do we legislate? Like I know in every organization that I own or I work, we have to have health and safety. You have to have the victim violence against women and domestic violence. It's all posted everywhere, but maybe it's time to look at our legislation that way and how we're going to hit every organization so that in the event that someone is there, whether they're in a hotel, whether they're a hospital, they could be working for the government and being trafficked in the evenings.
Yeah,
You know, so that they at least have this in front of them so that they know.
I'm probably run out of time, Mr. Chairman, but I just wanted to say to Sergeant Laflamme, thank you for the comment here. We've heard this before, that these victims, they are always re-victimized by preliminary hearings, and certainly the whole question of preliminary hearings is something that we've heard about, and I'm quite sure it'll be part of our recommendation. So thank you very much. Thank you, Mr. Chair.
Thank you very much. So next we'll have Mr. Bossino.
Thank you, Mr. Chair. Thank you to all of the witnesses today for sharing your testimony with us. Quick question for Ms. Lacey and Ms. Mosley. We've heard across the country that there are two solitudes, that there are people being trafficked and that there are women and men who are choosing to be in the sex trade. So here in Ottawa, so that we can get a picture, to your best knowledge, what percentage of women and men in the sex trade here in Ottawa are being trafficked, and what percentage are doing this of their own volition?
So I've been informed that if we look at the stats that, like working in a strip joint, as we said, that 70% of women that are working in the sex trade are actually being trafficked.
And what percentage of men?
We don't have those stats yet. They're not coming forward. But what we do understand is that it's more clandestine for men, and it's harder to admit. It's more shameful, so we don't have those stats right now. But
That's
we
fine.
do know that 90% of people that are being trafficked are women.
Okay, question for you. What percentage here, because the Action for Coalition on Human Trafficking in Edmonton said that 55% of the people they deal with are being trafficked for the purposes of sexual exploitation, 45% for labor, and 10% is a mix of both. What's the breakdown here in Ottawa, to your best knowledge?
I don't know that.
Okay, no problem. Question for the task force. Thank you for being here and for your emotional and frank testimony. I appreciate it. This is not easy work. Thank you for doing it. What is the work that you or any of your counterparts do for the hotels who are complicit? Do you do any outreach to the taxi people or the Uber drivers? And any outreach to the healthcare professionals that Ms. Leach talked about in terms of sensitizing them to who may be actually be coming through their doors?
With response to the education with the, I guess, the hospitals, we've done several presentations to CHEO as well as to the Civic Hospital. We anticipate more of those types of presentation and educational awareness in the future. Your questions were kind of threefold. So
Hotels.
Hotels. We sit with a lot of the hotel associations and conduct presentations with them currently. We've got an initiative that we're trying to spearhead at this particular point with them, where what we're going to be planning on doing is having flyers or posters put up in hotels with their permission and their consent, whether it's in a room or in public areas as well. To say that the hotels are, we do suspect that some hotels have employees that are complicit. I don't think that hotels per se are complicit. It's very difficult to extract information because under the freedom of information, they're not necessarily obliged to provide us with any information for that matter. And sorry, your third.
So FinTrack is now providing you with financial information.
Yes, yeah.
We have been advised to look at legislation protecting the pimps and the traffickers' phones so that it doesn't take a year's worth of work to try to get them to compel the information in their phone. Is there something similar we could do with hotel information So I've just let you ponder that. The other piece is, because it came up with our taxi driver when we were in Edmonton. After chatting with him for a little bit, he said, I think I dropped a woman off at Travelodge South who was trafficked. She said she's from Vancouver. She has a Francophone accent. She kept talking in French. She said, pick me up in 48 hours. I have to go back to Vancouver. And he said, I had never thought of it that way before. He said, you should really come and talk to the taxi association and talk to the Uber drivers. He said, what happens though if I call? Will the police arrest a woman who's doing this of her own choice? I said, well, that's really up to each jurisdiction. It's not a problem to sell sex, it's a problem to buy sex. And he said, so if somebody's being trafficked and I call the cops, they could help that woman or that man. I said, yes, that's what we're learning. And so he found it very interesting and doesn't want to be part of that chain that delivers someone in the human trafficking chain.
Okay. We frequently receive Crime Stopper tips that we act on. And those, as you would know, are anonymous.
Sure.
And a lot of the times it corroborates information that we either know or suspect. There is an initiative that I'm aware of in Houston where they've done a lot of education to the taxi drivers and Uber drivers. I believe they're posting ads as well in their vehicles. So that's an initiative that we're hoping to undertake as well. And I would suggest that if we're in a position where we're able to present to those types of groups, if they wanted to bring information forward that was, I guess, confidential.
You could act on it.
We could act on it, absolutely. We could deal with the information as source information or through the Crime Stoppers as well.
Last question, and it might come up in the short snappers at the end, but what do you actually say to you said you reached out to 21 sex trade workers and 2 took you up on the offer to leave the trade. Like, what is that conversation like that then those 2 women, I'm assuming they're women, said that they want to now leave and then you help with the victim, the support group that are around them?
Yes, they were women. Of those, the particular woman that I was making reference to that moved out of province, we had dealt with her on 3 separate occasions in the fall.
Was your 4th ask?
So we had contacted her. We had approached her through a proactive initiative, reached out and offered some services, at which point she indicated to us that she was actually independent and was traveling the country, and this was the means for her to pay for the travel and the sightseeing. On the 3rd attempt is when she realized I'm dealing with the same group of people that are not chastising me, they're not putting me down, they're offering me services, and we explained to her, we went over a lot of the safety plans that we usually tend to discuss with all the sex trade workers. And at some point, I guess the light bulb came on, and she realized that we were there for her, and she decided to take us up on her offer, and we were able to get her a plane ticket home within the next 12 hours.
Thank you.
Thank you. Incredible information, so little time. I'd like to start with Dr. Benoit, if I could. First of all, delighted you could join us from Victoria, and I want to salute you for the enormous contribution your research has made over 20 years. You said 2/3 of the sex workers that you interviewed say they have little or no confidence in the police, and you gave 3 or 4 reasons for that. So I guess the logical question is, if the police need to do better, what do you recommend that they should do to improve their ability to detect potential victims where people are being trafficked?
Thank you. I think some of the suggestions have actually already been mentioned, but I in particular think police could have better liaison relationships with community organizations, of course, the organizations that are represented today, but also I would say sex worker organizations in the community who come in contact with a lot of people who are looking for other services. It could be health services, it could be food, it could be safe sex supplies. So those groups as well have contact with people who may be in danger for human trafficking. In Victoria, where I'm located, the police have done a wonderful job to try and reduce sexual assault increase sexual assault reporting for sex workers in the community. And they have done that by connecting closely with different health, social services, as well as the local sex work organization to actually assign police officers to work with these organizations and to receive training around how to be respectful, how to be non-judgmental, not to use stigmatizing language, and to increase the reporting for all kinds of victimization, sexual assault, but also if there's human trafficking. So I think there's a lot the police can do in some jurisdictions. It seems here in Ottawa, but also in Victoria, the police are making some strides in that way.
As a social scientist and doing your research, you started by your remarks by giving us some idea of the kind of evidence that you've been able to gather. We've heard in different places from Statistics Canada and from people on the front line, community service providers, of the difficulty in acquiring useful statistics on human trafficking and related activities. Has that been your experience? And if so, do you have any recommendations on how we can improve the gathering of statistics?
Well, I think we have to realize that human trafficking is a very hidden activity. The sex industry in Canada is very hidden, and you have criminal code sanctions against an activity, it's very hidden. So even perhaps more hidden and in the shadows is human trafficking, and not only in Canada, across the globe. So we need to, we can depend on some people coming forward through victim services and so on, but we're not necessarily getting at the on the ground into the communities where traffickers may be moving. So I think we need to use a variety of strategies, including using social science research methods to get a diverse example of people in communities where you might like to find people, and then do some other investigative research there.
Dr. Benoit, you've done your research, you said, over 2 decades. We've had a Supreme Court decision in Bedford in 2013, and then we had a statute, Bill C-36, responding to that. Have you seen any impact of that case and that legislation on the human trafficking situation in Canada over your research career?
It's a little early to tell because the law's only been enacted since 2014. I have done follow-up interviews in Victoria in 2016-17. What I gather from the people I interviewed there, that these laws have not helped them feel safer, that especially for Indigenous people, they have actually have to be more hidden when they're involved in sex work because they don't want their clients to be discovered and so on. So whether it's impacted human trafficking, I don't know, because we don't really have those data in front of us. So I do think it's made it more difficult for people who legitimately want to be involved in sex work to be able to do so. And I don't think it's increased confidence in the police.
Thank you. I'd like to direct my next question to Ms. Mosley. You understandably talked about the difficulty of requiring victims to testify in the criminal process and how difficult it is. But on the other hand, there's really little choice but to have them testify in the criminal process. I'd like to, you heard about some of the assistance that Sergeant Laflamme has told us that his force is trying to provide, but at the end of the day, a very serious crime, trafficking, is going to require cross-examination and the whole panoply of the criminal justice process. Isn't that true? And if so, what can we do about it?
I think it's very difficult because when you have someone, and when we're looking at trauma and trauma bonds with the victims, the perpetrators and the pimps, there's that fear as well as that they're being disloyal. So we have that help, but it's how do we get them from point A to B? When we look at trauma and the way it affects people and mentally, and how long are court cases, like, someone could be charged, 6 months ago and we're still waiting for the trial. And while they're living with that and trying to stay within it and get their health together, but mental health is very difficult to deal with. And then if we don't have the services for them, yes, we have victim services and they get, I think it's through Ottawa Victim Services, you can have 5 counseling sessions. Well, some of that's been, it's very low.
So speedier trials, perhaps getting rid of preliminary inquiries where we have to do it all twice, better victim support would be critical. Making sure that when they do show up for that trial, it's not going to be put off because there's something else going on and they have to return. Those are some of the practical things that might, and using FINTRAC evidence to do certain things that you wouldn't need the victim to testify about. Those are some of the practical things. I just wondered, are there any other suggestions that you or perhaps Sergeant Laflamme might have to make things better here?
Sir, I believe the Jordan decision is acting very favorably with regards to expediting trials. Therefore, I think we're making great steps with regards to speeding up the processes. I do believe that as a result of the type of investigations we do, a lot of our victims are very transient. And there is a lot of difficulty trying to get them to come back to the jurisdiction for the specific trial.
One thing that we heard about, last quick question. We've heard from a number of people that when you're trying to rehabilitate, get back from being a sex worker and get a job, the first thing you face is you have a shoplifting conviction or something else because you've stolen something in order to stay alive during this slavery that you've experienced. How would you feel, you've given us your views on preliminary inquiries, about the expungement of criminal records for people who are in fact victims of trafficking so they could get back into the workforce?
That's a heavy question. I think it needs to be sort of looked at on a case-by-case basis based on the charges that maybe that person or that victim has and the previous convictions and what they relate to. I would agree that there are certain circumstances where we have had victims that have been arrested for shoplifting or for frauds based on, the middle or the type of work they're in and being forced to do so based on traffickers. I think
and then they can't get a job afterward.
Correct, and I think if there was a way to sort of ascertain or determine that those charges are sort of on the peripheral of the trafficking as a major concern, then we could deal with those charges at that particular point.
Thanks very much.
Question, I think I'll start with Dr. Benoit. I'd like to build on what Mr. Murray was talking about regarding data. So, and I'd like to understand your testimony a little better. I believe you said that human trafficking is not widespread among adults, and that in your study, I believe it was in 2014, 66% of the respondents indicated that they had been forced at some stage in their lives into a human trafficking situation. So in that testimony, you seem to be a bit of an outlier from the kind of testimony we were hearing from quite a number of people. I'm wondering if you have an explanation for that, whether your data, whether it's a difficulty in collecting data or whether the other data that we're hearing is more anecdotal or what. And in that respect, I noticed that you mentioned that in one of your studies, you required that the people involved in the study had to be legally able to work in Canada. And I'm wondering if that might skew the results in terms of eliminating people who are not able to work in Canada, but who were nevertheless trafficked. So if you could respond, I'd appreciate it.
We seem to have lost the audio. 1 second. Is it our audio also gone? Dr. Benoit, we seem to have lost the audio. Did you press the mute button? No. No. Maybe we could do hand gestures. No, not working. Maybe one sec, Mr. McKinnon, perhaps you could pose your second question to somebody in the room, and we're going to come back.
Okay,
Well, we're going to go on and try to fix it.
I'll move on with regret to, and not with regret to Ms. Leach, but I'll move to Ms. Leach. So you mentioned that 84% of individuals who are, you encounter, the health care providers encounter 84% of trafficked individuals while they're in captivity. I'm wondering where that statistics come from, and how would you recognize individuals as being in captivity when they come into a healthcare environment, and whether there's an opportunity for healthcare providers to intervene in such a case?
Mm-hmm. So where those statistics come from, so I have the privilege of belonging to a group, it's called HEAL, which is basically US. So where that data comes from, so unfortunately in Canada we don't have such data, is research of survivors through US-based research. And so sometimes those statistics can range. Certainly the highest is 84%, the lowest I've seen is 24%. And so where that information becomes relevant is that we're noting that people who are experiencing trafficking at the time where they are being held in captivity are coming to access health care. So part of what I wanted to bring forward to this committee is that as a healthcare professional, we're not necessarily educated, one, on how to identify and how to intervene. Oftentimes when healthcare providers are looking for something, they're looking for what's called a validated screening tool. And in Canada, currently, we don't have one. Oftentimes, when you look at survivors and what they'll voice is that they feel like when they access healthcare that they're not being seen for who they are. And so they might be seen by that presenting complaint, like the example that I've given, like a broken bone. But to be able to capture the essence of why they're there, the complexity of why it is they're there, and their circumstance of trafficking, that isn't being identified. The best example I can give you is that there's no diagnosis, or what we would call an ICD code, for human trafficking. So there's no way for me to code an individual as this is their circumstance. I have to then code it as the sore throat, broken bone, et cetera, of what might be there. So for healthcare providers to be able to intervene, they need to sort of have these tools for themselves, and they need to be able to be taught to ask questions and to be able to go with that on gut instinct that they might have to further delve into this person's life and realize what choice they have with regards to their employment, what choice they have with regards to finances, life, etc., which we call as a social history screen.
Ms. Dr. Benoit's back
Hello?
online. Can we see if we can hear you?
Hello?
Yes.
Can you hear me? Yes, okay.
Yeah.
Thank you.
So we're back to Mr. McKinnon's first question. Go ahead.
Yeah, I think it's important to note that I'm not a researcher of human trafficking. I'm studying the organization of sex industry in the country. I'm looking at the health and working conditions of people involved, and I'm interested in their access to non-judgmental services. So I've used a variety of survey methods to try and get access to the diversity of people who are involved in the activity, and in those an hour and a half length interviews, human trafficking has been mentioned. It comes up when I ask people about their early life events and how they got involved in the sale of sexual services, and that's where 6% describe themselves being forced or exploited in their earlier life. So that definitely differs from what some of the other work that or information you're hearing, which is when victims of human trafficking are connected with services. So that's very, very different. And in studies of the sex industry, where your example is only a clinical example, that is only people who go to seek services, then you get a much more homogeneous sample than the one that I described that we have found in our research. Secondly, why we chose in our study to be legally person had to be legally able to work in Canada, because we were interested in the impact of the prostitution criminal code laws, adult prostitution code laws on people's ability to work in the country and their experiences of health, safety, and victimization. So that's we were especially interested in the Bedford and the consequences that would be happening in the criminal code. So that was the reason why, and also the reason why we chose people as adults.
Okay, great. Thank you.
One more question, Mr. McKinnon, because there's about a minute left.
Okay, so I'll move on now to the Ottawa Coalition and Human Trafficking. I believe you said, and I think it was Ms. Lacey, that we need a national action plan again. We had one.
Yes.
What do you think that is the plan that we need to go forward with? Does it need changes? And what if we do need changes, what improvements would you suggest?
Well, I think that absolutely there's a need to go back and revisit in terms of what work had been done previously. And I think based on the information that you're getting in some of these inquiries and discussions, I think that it can be evaluated and compared against kind of more current and recent feedback and information to inform making some changes to that strategy. I do think that, part of our discussion on the coalition table is around the need for the national component of things, kind of incorporating all provinces, all territories, and all communities as well, because we do feel that it is something that we're seeing across the board.
Thank you.
Short questions from members of the committee and short answer. So this is to get questions out quickly and answers as quickly as you can answer them reasonably, okay? Mr. Cooper.
Thank you, Mr. Chair, and thank you to the witnesses. I want to follow up with Sergeant Laflamme and Ms. Mosley with respect to preliminary hearings. You have recommended that they be done away with in order to minimize the re-victimization of human trafficking victims. I asked the same question about whether or not preliminary inquiry should be done away with to a Crown prosecutor in Edmonton who appeared before our committee last week. That Crown prosecutor successfully prosecuted a major human trafficking case involving, I believe it was 71 exploited workers. And her answer to me was that she found the preliminary inquiry was essential to the successful prosecution of that individual. Part of the problem, she said, was that she had witnesses who were disappearing. And so if she had to wait to go to trial, that witnesses that she needed to get evidence in wouldn't be available, compromising the likelihood of a successful prosecution. I was just wondering if you might be able to comment on that, and perhaps also just, Sergeant Laflamme, the experience in Ottawa with respect to, as you mentioned, the successful prosecution of several cases in Ottawa.
I think commenting on a trial in another jurisdiction that I'm not familiar with, I'm not quite sure if I can really answer what my beliefs are with regards to that specific preliminary hearing.
But I mean, the underlying concern, which is that, if you have to wait to trial, the preliminary inquiry provides a valuable opportunity to get evidence from witnesses early.
We frequently have victims that we manage that end up testifying in a preliminary hearing, and they're cross-examined by defense lawyers. Then they're treated and demeaned and felt belittled to the point where they are not in a position where they want to come back for the said trial. And so we have to contend with that on a pretty regular basis with respect to assisting those victims and trying to, encourage them to come back. And it happens quite frequently in our jurisdiction. I don't think we've had a trial specifically with that magnitude that you're referring to. But on a regular basis, we do have to deal with victims that decide they want to recant, or they feel that they're sort of not treated as equals, and that they're not credible as a witness, and therefore, as a result of that, don't want to come back.
Oh, that's fine, Mr. Chair.
Thank you, Chair, and thank you to the witnesses for coming before us and giving your testimony. As we were on the road, we heard from various police forces and law enforcement agencies about their experience. From one police service, we heard that they had done an operation in which they had posted an advertisement for a minor online, and had received about 700 hits on that advertisement. However, not one of the people that were on that page called 911 to report the minor. We also heard a lot of testimony about violence against people that are in the industry, whether they're there by choice or not. So I think, Mr. Sergeant Laflamme, my question to you is basically, what is the role of Johns when it comes to providing training, when it comes to providing awareness, and really getting that buy-in from the public?
Would it be possible for you to rephrase that question? I'm not sure that I understand what the role of a John or what you're trying to.
In terms of the person who is buying the sex, what is their role in terms of eliminating trafficking, if they can? I mean, this we've heard that there are different ends to the spectrum where there are people that are in this industry by choice, sex workers, but then there are also those that are coerced into it. The one thing that is in common with both of them is the person that is purchasing the service. So in terms of educating the person who is purchasing that service, what kind of training or awareness can be given to those people to ensure that that they're not participating in something that is harmful?
Well, prior to the Bedford decision, we at the police service used to have prostitution sweeps. And so what we would do is we would go out and basically, at that particular time, round up all of the sex trade workers because they were on the streets providing sexual services. And at that particular time, then we would reintroduce our undercover officers and then arrest the Johns. As a result of those, we would have John schools where there would be education sessions. I believe it's about a 5-hour education session. It's a pre-trial or pre-diversion program for somebody that's not a repeat offender. And so with the example that you've given that another police service has done such an initiative, we're planning on undertaking doing stuff like that. Are basically very much more focused at this point in sort of establishing our unit. But we anticipate doing somewhat of a same type of venture, but we're running into problems with the actual pictures being posted because you need someone's consent in order to post that picture. You can't, as a police service, arbitrarily take a picture off the internet without someone's consent. But at that particular point, I think we will most likely have a lot of success with regards to arresting the Johns, and that is something, the John School, for lack of a better term, is what we will be sending the people that, or the males that are arrested to a pre-charge diversion type of program. I know that we're actually giving some lectures on one, as a matter of fact, tomorrow night. But it's been sort of a compiling of certain incidents that have necessitated us to have a John School, and it's the first one since, I believe, the Bedford decision.
How much do you collaborate with other police services, whether in the province or across Canada?
Well, we work hand in hand with the Gatineau Police Service. As I alluded to earlier, they were part of our initiative prior to the Grey Cup. We see a lot of girls, there's a lot of trends where we see a lot of girls from the Quebec side or mainly Montreal area, coming over to work in Ontario simply because the supply and demand is different. What they can actually charge is higher in Ontario than on the Quebec side. So we have a great partnership with the Gatineau Police Service. We're in conversations as we speak to have an initiative with the OPP and the RCMP as well within the next couple of months. And as a result of the success that we've had with the Grey Cup initiative, we're hopeful that we'll be asked to assist Montreal in their provincial task force during Formula One festivities in June. And that's something that as recently as last week, I was in conversations with the Montreal Police Service.
Thank you.
Anyone else have any questions? Mr. McKenzie?
Thank you, Chair, and thank you to the panel. I think everyone in this room has the same goal, and that is to assist those people who have been victimized by traffickers. And so to do that, one of the things, obviously, is we all have to identify the victims and work with them. And from the perspective that I have is that the social workers that are present, basically, you have victims identify to you in some manner, whether you search the information out and identify it, but they basically come to you. Would that be a fair assessment? I think that's basically. The police agency, on the other hand, tend to be on the street and identify, and as you've indicated with the Grey Cup, try to talk people into whatever it may be to give them assistance. Would I be right in assuming that we could benefit everybody if we had perhaps more social workers on the street? Like, I know what the police do, and I'm 1,000% behind that, but we always end up with the police being seen as sometimes, as the professor says, the bad guy. But I'm wondering if part of this equation is we need more trained social people on the street. Anyone? Sure.
So what we have right now is we actually are going on in training, and people are getting training all over the place. I mean, the coalition goes out, Operation Come Home. We've trained over there. We're starting a hotel initiative, Carleton University. Next month, I'm doing the 211 operators. The thing is that there's not enough programs. Up until a few weeks ago, we were sending victims of trafficking out to BC from Ontario to have programs. There are 2 beds through Windrose. There's a few programs, one in Covenant House in Toronto, and now with the initiative and the funding, there are more, but what we're lacking is in services completely. So yes, we need more social workers on the street, we need more training, but we need more services.
Okay. The police have always, and I'm a little biased, but the police have always been on the street dealing with all of those people, sometimes with little or no training, but what they've learned on the street. And I'm wondering, Sergeant, if you can tell us if your people have specific training, and also if there's a mix of male and females in your team.
Thank you for the questions. We have 4 investigators, 2 of which are female and 2 of which are male, and everybody is fluently bilingual. We sit on a lot of steering committees and human trafficking committees with a lot of other social groups, and we share a lot of information. There's a lot of referrals that come our way based on the committees that we sit on and the phone calls that we receive. We also teach at various different levels of courses within the police service, whether it be on a sexual assault response officer course or an initial course such as a general investigations techniques course. And we're also teaching at the Canadian Police College as well as the Ontario Police College and the Criminal Intelligence section of Ontario, or Services of Ontario.
Very good. Thank you, Chair, and thank you to the members.
One brief question, Sergeant, if it's okay. One of the things that I heard as we were traveling the country, and this is coming back to my colleague Ms. Khalid's question, was that people who are procuring sex, and I won't signify that it's one sex or another because it could be both, even though it's mostly men, buying it from mostly women but could be men, could be the biggest ally in terms of identifying people who are being trafficked. If purchasing sex wasn't criminalized and people felt free to come forward and say that this is what I'm seeing. The same as what women in the sex trade that we met with were telling us, that they could be the biggest ally of police in those cities where they feel confident to talk to the police and point out underage women, people being trafficked. I'd like to get your commentary on that, if Dr. Benoit, on whether or not that approach is a feasible approach to say, let's work with the people who are in this trade, who are consenting, who are adults, to help identify people who are being compromised and being trafficked. So I'll ask the sergeant and then Dr. Benoit to just answer my question.
I can give you a sort of a case in point where we worked with somebody who essentially wanted to remain anonymous, which is exactly the circumstance you've provided. And at that particular time, that individual actually was amorous of the sex trade worker and ultimately was jealous of any other clients that she was servicing. And it was somewhat of an extensive and exhaustive investigation to draw that conclusion. However, I think if it was legalized or there was some legitimacy of it, if you will, I'm not so sure that we would have individuals coming forward to provide us with that. I think that we concern ourselves with anybody that we feel, based on a number of cues, are being trafficked, or mainly underage girls. And that is, I think, the focus that we have. We've seen countless investigations where Johns are fully aware that this individual is underage, and nobody has been in a position where they've either called us or reported it. And that's unfortunately the reality that we're faced with. I don't want to sit here and sound very pessimistic, but with regards to anybody coming forward with that information, I guess there needs to be more of a extensive study done on that particular matter to confirm or corroborate whether somebody would or not.
Thank you so much. And Dr. Benoit?
Yes, well, there have been studies of clients, including some of my own colleagues here in Canada, and also a fairly large study of clients or people who buy sexual services in Sweden after purchasing was criminalized. And those people reported in those interviews that they were less likely to come forward with information about someone who was being forced into prostitution or being held against their will. Of course, with legitimate reasons, because they were fearing that they would be arrested for purchasing. So, and in Canada, I think we have the same situation where people are now fearful to come forward. And it's the same with people who operate in escort agencies or massage parlor. If they see something, it's very difficult for them to come forward at this point in time, given our law. But there could be practices even now where we say an amnesty for coming forward with information about illegal or especially human trafficking activity or minor being involved in sexual exchange. And I think actually clients and other third parties would be much more willing to come forward with information if we knew the justice systems would not criminalize them. And that would also, of course, be for sex workers themselves.
Thank you. Not seeing any more questions. I want to thank the panel for being here today. Thank you, Dr. Benoit, for joining us from Victoria, and have a wonderful rest of the day. Meeting adjourned.
Thank you.